You have a Medicare Supplement plan, but the premium keeps going up. You find another company offering the same exact Plan G for less money, so you decide to switch. But then the application starts asking about your prescriptions, hospital stays, and medical history. Why are they allowed to ask you these questions? Can your health history cause you to be declined? And could choosing the wrong company prevent you from switching at all? Today, we're explaining exactly how Medicare Supplement underwriting works and why the agent helping you needs to understand more than just which company has the lowest price. Hi, my name's Hannah Skinner, and I'm a licensed insurance agent at the Senior Savings Network. Medical supplement underwriting is one of the most misunderstood parts of Medicare. Some people believe that they can change Medicare supplement plans every year without answering health questions. Others are afraid that a single medical condition means they can't switch for the rest of their lives. Neither of these statements are completely true. Whether you have to answer health questions and whether you qualify depends on when you apply, why you're changing coverage, which state you live in, and which insurance company receives your application. Let's break it down. Medical underwriting is the process an insurance company uses to evaluate your health before deciding whether to issue you a Medicare supplement policy. The supplemental company may review your answers to health questions, your prescription history, and in some cases, medical records or diagnostic information. The purpose is to determine whether you meet the company's eligibility requirements. Underwriting is not Medicare deciding whether you qualify for Medicare. You can still have original Medicare Parts A and B regardless of whether a Medicare supplement company approves your application. The underwriting decision only applies to the private Medicare supplemental policy that you're trying to purchase. Although we don't recommend just having original Medicare by itself, as there's no maximum out-of-pocket. The most important time that you can avoid underwriting is your 12-month Medigap open enrollment period. In most states, this period begins 6 months before your Part B effective date and lasts 6 months after your Part B effective date. During these 12 months, an insurance company cannot deny you a Medicare supplement policy or charge you more because of health issues. This is generally a one-time enrollment period. It does not come back every year. And this is where many people get confused. The Medicare annual enrollment period that happens from October 15th through December 7th is primarily for Medicare Advantage and Part D prescription drug plans. It does not automatically give everyone the right to purchase a Medicare supplement without underwriting. You may be able to leave your Medicare Advantage plan during an enrollment period, but that does not necessarily mean that a Medicare supplement company must accept you. Medicare specifically warns that there are limits for when someone switching to original Medicare can add a Medigap supplement. The annual election period is right around the corner, so call us at the number below if you would like to see if you would pass underwriting. You may also avoid underwriting if you qualify for guaranteed issue rights. Guaranteed issue rights can happen in certain situations, such as losing qualifying coverage through no fault of your own or using certain Medicare Advantage trial rights. When you have a valid guaranteed issue right, the insurance company must sell certain Medicare supplement plans and cannot charge you more because of your health. If you have a Medicare Advantage plan that leaves Medicare, you qualify for guaranteed issue rights. You'll get a letter in the mail stating that your plan will not be available anymore and that you have these rights. Do not throw away that letter. It's your golden ticket to get a Medicare supplement plan if you can't health qualify for one. You usually will get this letter around the end of September or early October. State laws may provide additional protections, so your rights can be different depending on where you live. We have a video on our channel that explains birthday rules and different rules for different states. Why are companies even allowed to ask health questions? Medicare supplement policies are sold by private insurance companies. Federal laws give you strong protections during your Medicare open enrollment period or during guaranteed issue situations. Outside those protected periods, however, federal law generally allows insurance companies to use medical underwriting subject to additional rules in your state. That means a company can evaluate the likelihood that an applicant will have significant medical expenses and decide whether that applicant fits its underwriting requirements. In simple terms, insurance is designed around people joining a shared risk pool. Underwriting helps to keep prices lower for everyone in the shared risk pool. In places like New York, where companies are not allowed to ask health questions, we see rates that are much higher than the rest of the country. If everyone could wait until after receiving a major diagnosis or scheduling an expensive procedure before buying or switching coverage, the insurance company would immediately take on expenses that were already known. That's why the law gives you a protected opportunity to enroll when you first become eligible, but may allow underwriting when you voluntarily apply later. After your 12-month Medigap open enrollment period ends, Medicare says you may have fewer policy options, may pay more, or may be denied if you do not meet an insurer's medical underwriting requirements. You may be wondering, what health questions do they ask? There's no single universal Medicare Supplement health questionnaire. Every company can use its own application and underwriting guidelines, and those guidelines can vary by state. However, common questions involve conditions such as heart attacks, congestive heart failure, strokes and other cardiovascular conditions, cancer, leukemia, lymphoma or melanoma, kidney disease or dialysis, insulin-dependent diabetes, sometimes with additional questions about complications, chronic lung conditions, neurological conditions such as Parkinson's disease, multiple sclerosis or Alzheimer's disease, organ transplants, recent hospitalizations, residence in a nursing facility, or hospice care. Pending surgeries, medical tests, or procedures that have been recommended but not completed can also be asked about. Most companies will have different guidelines when it comes to underwriting. Some carriers might deny you for having diabetes if you're taking insulin. Some might only deny you if you're taking a certain amount of insulin. Some don't care at all. Some might deny people that they feel are overweight or underweight. Some companies don't even ask about height and weight. A current insurer application, for example, asks about some conditions during the previous 2 years, cancer and transplants during the previous 5 years, certain diagnoses at any time, and whether the applicant is currently hospitalized, in hospice, or confined to a nursing facility. This example also shows why you cannot assume that every medical question has the same time frame. A company may ask whether something happened in the last 2 years, the last 5 years, or at any point in your life. They may also ask about tobacco use, mobility limitations, or whether you need help with activities such as bathing, dressing, or eating. And even when an application does not directly list a particular diagnosis, the company can review your medications. Certain prescriptions can indicate underlying conditions or recent treatment that requires additional review. A question that we get a lot is, does answering yes automatically mean you'll be denied? Not always. Some questions are what agents may call knockout questions, which is when a yes answer may make you ineligible for that particular company at that particular time. Other questions may simply trigger additional review. The company might request more details, conduct a phone interview, or ask your doctor for records before making a decision. The final result could be approved at the quoted premium, approved at a different premium when permitted, a request for more information, or a straight-up decline. But here's the key. Being declined by one insurance company does not always mean you would be declined by every company. And that decline does not affect your chances with other companies or affect your current coverage. One carrier may require 5 years to have passed into certain diagnosis. Another may only require the previous 2 years. One may decline an application because of a certain medication, while another company's guidelines may allow it. That's why working with a broker that knows the underwriting guidelines for each company rather than just the lowest rate is so important. So how does underwriting affect your coverage? Underwriting primarily affects whether the insurance company will accept you and what premium may be offered. It does not change the core standardized benefits of the plan. For example, the basic benefits of the standard Plan G are the same regardless of which company sells it. The company cannot remove one of the Plan G's standardized benefits simply because you have diabetes or heart disease. However, a pre-existing condition waiting period may apply in certain circumstances. Depending on your prior creditable coverage and other circumstances under which you enroll, a company may temporarily delay coverage for costs connected to a pre-existing condition. That is a separate issue from whether the application itself is approved and should be reviewed before the policy begins. It's also extremely important to understand that submitting the application is not the same as being approved. Do not cancel your existing Medicare Supplement policy just because you applied for another one. Wait until the new insurance company has approved the application, issued the policy, and confirmed the effective date. Medicare provides a 30-day free look period when switching Medigap policies and advises consumers not to cancel their first policy until they've decided to keep the second one. You could have to pay both premiums during that month, but it's much safer than accidentally being left with zero supplemental coverage. We will also work with you and the company to make sure that the effective date that you choose doesn't overlap with your old coverage so that you're not stuck with two premiums. When it comes to answering the health questionnaire, never guess, hide a diagnosis, or leave out a medication because you're worried about being declined. Your application becomes part of your insurance contract. Something important to know is that there's a 2-year contestability period with all Medicare Supplement policies. If the company later determines that an important answer was incorrect or incomplete on your application within a 2-year period, it may be able to adjust your premium, rescind the policy, or deny claims, depending on the circumstances and applicable laws. After the 2-year contestability period, your coverage cannot be rescinded. If they rescind your policy, they do have to pay back all premiums paid to the company, but this could result in your treatment not being paid for. A knowledgeable agent should never tell you to answer a question inaccurately. The agent's job is to understand your health history, interpret the question correctly, and determine which company is most likely to consider your application, not hide the information from the insurance company. A Medicare agent who understands underwriting does much more than compare monthly premiums. First, the agent should know the health questions and look-back periods for multiple insurance companies. An agent should be able to recognize that your recent hospitalization might be acceptable with one company, but disqualifying with another. Second, an agent should review your prescriptions. The name of the medication, the reason it was prescribed, and whether you're still taking it can all matter. A good agent may need to ask follow-up questions before recommending a carrier. Third, the agent should understand guaranteed issue rights. You may qualify for protection because you're losing employer coverage, leaving a plan that ended its contract with Medicare, moving out of the plan service area, or exercising Medicare Advantage trial right. But those rights frequently have deadlines and documentation requirements. Missing a deadline or failing to keep the correct termination notice can affect your ability to prove that you qualify. Fourth, the agent should understand your state's rules. Some states provide additional opportunities to change Medicare Supplement plans without full medical underwriting. These rules may limit which plan you can choose, when you can apply, and how much coverage you can add. Again, we have a video on our page all about the state-specific rules about underwriting. Make sure to check it out. And finally, the agent should know when not to submit your application. Sometimes it's better to wait until more time has passed since a hospitalization, surgery, or treatment. Sometimes a different insurance company is a more appropriate option. And sometimes keeping your current policy is safer than risking coverage change. No honest agent can guarantee that an underwritten application will be approved. But an agent who understands the guidelines can help you avoid applying with the wrong company, missing a protected enrollment right, or canceling valuable coverage too soon. Here's what you need to remember. Medicare Supplement underwriting is a review of your health used by a private insurance company to determine whether it will issue you a policy. You normally do not have to pass medical underwriting during your 12-month Medigap open enrollment period or when you have a valid guaranteed issue right. Outside those protected situations, the company may ask about your diagnoses, prescriptions, hospitalizations, pending procedures, and other parts of your medical history. Your answers can affect whether you are approved, declined, or asked for additional information. And because every company's guidelines are different, choosing the right carrier is just as important as choosing the right plan letter. Before changing a Medicare Supplement policy, speak with an agent who understands the underwriting rules in your state and represents multiple insurance companies. At the Senior Savings Network, we can review your situation, compare your available options, and help you to understand the underwriting process before the application is submitted. And remember, never cancel your current Medicare Supplement until your new policy has been approved and you're certain you want to keep it. For more straightforward Medicare information, subscribe to our channel, like this video, and let us know in the comments if you've ever gone through underwriting. And don't forget to share this video with someone starting Medicare for the first time or someone thinking about changing their plan. Thanks for watching, and we'll see you in the next video.